Miles, who's participating in our research reception this year. Thank you very much.
Thank you.
Gayla's poster is called Dwell Time of Ultrasound-Guided Peripheral Intravenous Catheters. And I know that here at our hospital, we have a pretty robust program training nurses to do this.
Yes.
And I also know you know something about the history of that. And I think before we talk about your project, perhaps you could tell us a little bit about the history of the program here and why we began to teach nurses how to do this particular technique.
We began originally with the problem of patients in the emergency room not being able to get IV access, and so they would either have a central line inserted or they would wait for a PICC line nurse, which sometimes takes 12 to 24 hours to get access. So there were tests that were postponed, and so to get IV access, and then also the potential complications of putting in a central line and the cost. The physician has to put it in, and that takes time, but then also the complications of potential pneumothorax, the line being placed in the wrong, anatomically wrong. There are several complications. So they asked if the nurses couldn't use ultrasound to start visualizing deeper veins, and the physician, Dr. Spear, thought it was a good idea. So they just tried it initially, and it was very successful. So they decided to do that. They did a study initially in about 2007, and they had actually saved a lot of money and decreased complications by using the peripheral guided ultrasound guided IVs. So it kind of took off from there. So now we've been doing it probably about 7 years, and it's heavily used within the hospital.
Okay. So not just ED does this, right?
No, nurses from all over the hospital and the Metroplex are taught how to use ultrasound to insert the IVs. And actually it's caught on internationally. They're doing it overseas as well.
Okay. And how is this, can you describe a little bit about the procedure itself and how it's different than just inserting a peripheral IV the traditional way?
When you use traditionally, to put an IV in, you're visually looking for veins that stick out, or you're feeling to see if you can feel it. You definitely feel the puffiness of a big vein. So it's generally not hard to find, except if they don't have any veins that are visible or palpable, then it becomes much more difficult, and it just basically becomes a blind stick. If you use ultrasound, you still use the tourniquet as you would to start a peripheral IV traditionally. But you bring the ultrasound machine to the bedside, and you clean the area just as you would before, but you use the ultrasound machine, and you can actually just see the deeper veins as you wouldn't be able to see without it, and you can tell how deep the vein is, how big it is, and anatomically where it is. And then you can also watch where your needle is as you put it in, so you can guide yourself into the vein.
Okay, great. And your research question this time was not about cost savings and so forth. It was an entirely different research question. What were you trying to find out on this study?
Well, using ultrasound to start IVs had been going on for about a decade. Initially, in the United States, it was done mainly by physicians, and then the nurses kind of took over because nurses actually insert them IVs much more often than physicians do. So they were concerned. The report back from the nursing staff was that the ultrasound-guided IVs didn't seem to last as long as the peripheral IVs. And I did a literature search that only found one study within the past decade that actually looked at how long the IVs last in the periphery. And so we just wanted to compare how long the traditional peripheral IV lasts compared to the ultrasound-guided, and, was it definitely shorter? We just really didn't know.
Okay. And for this poster, then, you're referring to dwell time. And by dwell time, you mean the time from placing the IV till it falls out for whatever reason, right?
It falls out or infiltrates.
Okay.
That was the other, it's deeper, a little harder to tell if the IV infiltrates, if it's deeper in the tissue, but that was our concern. And so many times the patients are going for CAT scans, and the IV dye goes into the arm, and so you just want to make sure that your IV is definitely patent. So we just wanted to have a definite idea of how long the ultrasound-guided IV lasts.
Okay. And your method for this was a retrospective method, correct?
Mm-hmm. Yes.
And what did you all do to find the data to answer your question?
We asked that we get electronic charts or summaries, not summaries, electronic records from the database that we have since we started using the electronic record. And we asked that we pull 300 patients who had peripheral IVs and 300 patients that had the sono-guided IVs. And within the system, it didn't have to be here at Harris. And so we were trying to, it was over a 3-year period. And the patients had to be admitted so that we could definitely look at the length of stay of the catheter.
Okay. And I know that you actually ended up using several databases. You started out using THRE's research database, and we discovered that a traditional IV placed by a nurse could not be found in that database because it doesn't have a charge code attached to it.
Right.
You were able to find sonogram-guided IVs, but not traditional ones.
Right. So then we couldn't compare the length of stay. And so then we had to go through another route through medical records to get the information to know the exact length of stay on the other, on the traditionally placed.
And length of stay meaning dwell time.
Meaning dwell time, yes, or survival time.
Right. So you ended up really merging 2 databases. It was a pretty complex job, which took about a year just to get your data.
Yes, it took a long time.
You're very patient. Okay, so you found 300, and these were randomly chosen, 300 people who had a traditional IV stick and 300 who had sonogram-guided IVs, and you compared them. So what did you find?
That there was a significant difference between how long the traditionally placed IVs stayed in the patient's periphery or arm compared to the ultrasound-guided. That the ultrasound-guided really lasted around 27 hours, so basically a day, 24 hours, and that the traditionally placed IVs lasted about 62 hours, and that was about 2.5 days. So it was definitely significantly less than the traditionally placed IV.
Okay.
So the nurses were right. They had cause for concern.
Did you find out any other relationships? Did you look for any others?
We did. We wanted to know if patients with higher BMIs might get the peripheral ultrasound-guided IV more often, and that was significant. The answer was yes. It was definitely inserted more in females. The ratio, I think, from the amount on the sono-guided IVs, there was less than 100 on males, and there was over 200 on the females. So it was definitely almost double that the female received the sono-guided IV. And the length of stay was longer in the elderly or older. The more older you got, the longer the IV started. And we thought maybe that might be in relationship to the younger people moving their periphery more often, talking, using the cell phone, eating. And trying to think what else. That's all I can think of.
Okay. I think you had tried to relate it to certain diagnoses and weren't able to find a relationship there, right?
Well, we just looked at the amount. We wanted to investigate that further. I didn't find a true relationship. It seemed on the peripheral IVs, the patients with infections had the highest amount of placed with the traditional peripheral IVs. And the sono-guided appeared to be more the cardiac diagnosis. but we weren't able to look at histories to see about diabetes, renal disease, all that. So it was kind of vague and unclear.
Okay. So based on what you did find, what would your recommendations be?
The recommendation, we thought, Dr. Spear and I thought that the peripheral ultrasound-guided IVs are good as a temporary solution for an IV. If you are waiting, but if the patient's going to be admitted and they're going to need a long-term IV access, then they really need to have a PICC line placed if you can't get a peripheral IV traditionally placed or a central line. That the IV normally lasts only about 24 hours. So if the patient's going to be admitted and they have a ultrasound-guided IV, then the nurse really needs to make sure the physician's aware that they need to make plans for a more permanent type of catheter.
Okay. Do you have any plans to pursue this topic any further?
Yes.
All right.
We still have lots of questions. It's kind of a new concept, so there's lots of questions to be asked and answered. So
Okay.
we're looking at the depth of the angle of the catheter when it's placed, because it's definitely deeper, so we don't know if the angle of the catheter makes the IV not last as long, or is the length of the catheter, if it's not in, it definitely needs to be in a certain length. We wanted to look at that. There's also complication rates still need to be investigated. As far as we know, they're low, but we haven't done a true scientific study on it.
Okay. Thank you very much.
You're welcome.
Thank you very much.
Thank you.
Enjoy seeing your poster.
Thank you.